Hi, my name is Daniel Bay. I'm a dentist working in Massachusetts. Let me ask you a question. Has a dentist ever told you that you needed a deep cleaning? You may have asked yourself, what is the difference between a regular cleaning that you get every 6 months and a deep cleaning? In this video, I'll explain to you what it is and who may need it. Just before we dive in, let me explain to you a few important terminologies as well as concepts that may help you. During a dental exam, we have this thing called dental probing. We use an instrument to measure the length from your gingival margin to the base of your pocket, and we call this the probing depth. Each tooth has 6 measurements. One side, the side that is either touching the inside of your cheek or your lips, has 3 points: the back, the middle, and then the back, the middle, and then the front. The other side that is either touching your tongue or your palate has 3 points as well: the back, middle, and then the front. So there are 6 measurements per teeth. If the probing depth is between 2 to 3 millimeters or less, your gums are not inflamed. But if your probing depth is greater than 4 millimeters, your gums are inflamed. Furthermore, in our mouth, we have this thing called dental plaque. Dental plaque is basically a household of bacteria that attaches to your teeth. Plaque biofilm is composed of microcolonies of bacteria encased in polysaccharide matrix with channels that run through the mass, permitting passage of nutrients to the bacteria. We also have dental calculus. This is not when dentists do mathematics, but it is simply mineralized dental plaque adhered to our teeth. These plaque and calculus exist both above and below the gums. If it is above, we call it supragingival calculus, and if it's below, we call it subgingival calculus. And they promote an inflammatory response on your gums. Thus, you need to disturb and remove these plaque and calculus through great home hygiene, brushing, and flossing, as well as regular cleanings in dental offices. The health of your gums, as well as the ligament and bone supporting your teeth, we call it periodontal health. And it occurs when there's insufficient amount of plaque and calculus to promote inflammation. Gingivitis, which is gum inflammation, is characterized by gum tissue that looks red, swollen, and has bleeding when we do the probing measurements. These changes are due to the increased inflammatory response that destroys cells of the gum tissue, but have not progressed into the destruction of ligament and bone surrounding your teeth. The pathology associated with gingivitis is completely reversible, with removable of plaque and with resolution of the inflammation. On the other hand, periodontitis, periodontal disease, has the same changes that occur in gingivitis, except that inflammation and tissue destruction extends beyond your gums and goes into the ligament and bone. This results in irreversible destruction, leading to bone loss around your teeth. We must remove plaque and calculus to stop inflammatory response and hinder the disease from progressing further. Severity and extent of bone destruction is determined by the magnitude and duration of the patient's inflammatory response. During a cleaning, either that is a regular cleaning or a deep cleaning, the objective is clear. We want to remove plaque and calculus that are both above and below the gums. For patients with probing depths of 2 to 3 millimeters or less, we can reach the bottom of that pocket with our instrument without causing too much discomfort to our patients. Thus, you will be getting a regular cleaning every 6 months. However, if your teeth have probing depths of 5 millimeters or greater, we cannot use our instrument to go all the way down to the bottom without causing you pain. Looking at the right side of this picture, imagine having us go all the way down to the bottom of the pocket to clean your teeth. You would definitely need local anesthesia, local numbing for us to do a proper clean. During deep cleanings, which we call scaling and root planning therapy, SRP therapy, we numb you with local anesthesia and reach the bottom of the pocket and remove the subgingival calculus and plaque so that the inflammatory response is no longer promoted, to stop periodontal disease progression and maintain the bone level you're left with. If subgingival plaque and calculus are not removed, you will constantly have inflammation that leads to chronic destruction of ligament and bone that is keeping your teeth attached to your body. The longer the duration and more severe the inflammation, the greater destruction of bone. You can see from this photo that with the yellow line is where the bone level should be at, and the red line is where it's currently at. Chronic periodontal disease leads to bone loss around your teeth over time. Scaling and root planning therapy is both effective and reliable. Studies have shown up to 80% reduction in bleeding when we do the probing measurement, as well as probing depth reduction of 2 to 3 millimeters. After the deep cleaning, the connected tissue will take 4 weeks or more to heal. Full recovery process takes months. Thus, we reevaluate the patient at least 4 weeks after the treatment to see if you have improved or if the conditions have improved. For patients who show periodontal healing or improvement after the deep cleaning, they require no further treatment beyond routine maintenance. Periodontal maintenance is continued disruption of bacteria plaque through professional subgingival cleaning. Maintenance interval for the first year should typically be every 3 months. This time interval is based on clinical studies that evaluate the time required for recolonization of bacteria after subgingival cleaning. Interval may be altered after the first year based on the patient's response to the therapy. On the other hand, if there are no improvement after the deep cleaning, the patient has residual deep pockets, they may need surgical intervention to stop the periodontal disease from progressing. The overall idea of dental cleaning is quite simple. Remove plaque and calculus that are above and below the gums, as well as remove as much stains as possible. For patients with probing depths of 2 to 3 millimeters or less and with healthy gums, you can get a regular cleaning every 6 months. But for patients with pockets of 5 millimeters or above or with heavy inflammation, they do require a deep cleaning. Just before I end my video, I wanted to outline some risk factors associated with chronic periodontal disease leading to bone loss. Anything that alters the inflammatory response and/or lower your immune system can definitely play a role. Cigarette smoking is a risk factor. The number of years of tobacco use calculated in pack years is a significant factor in tooth loss and periodontal disease. Smoking not only dampens the response of host defense cells, but also leads to increased release of tissue-destructive enzyme. There also seems to be alteration in blood supply to the gums for smokers. Patients with diabetes mellitus have higher prevalence of severity of periodontal disease than individuals without diabetes. Diabetes does not cause periodontal disease, but there is evidence that it alters the host response to dental plaque. Lastly, stress. Stress can increase cortisol production and subsequently suppress the immune system. In presence of bacterial challenge, immune suppression may increase the potential of these pathogens to induce periodontal disease. All right, that wraps up my video. Thank you so much for watching. Please subscribe to the channel and follow me on Instagram. If you have any questions about dentistry you want me to answer for you, please leave them in the comment box below. See you soon.